Hi, everyone. Thank you for joining us. CMS recently proposed a significant amount of changes to Medicare provider enrollment. And although the rule is still in the proposal phase, several provisions could have meaningful operational and financial consequences for healthcare organizations. So today I'm here with members of our provider enrollment services team, Tara, who's the VP of provider enrollment services, and Kim Beely, who is the director of provider enrollment. And they are going to break down what is being proposed, why providers should be paying attention, and what organizations can begin doing now to prepare. So we want this to be a bigger conversation rather than a technical review. So let's start with the bigger picture. When you first reviewed the proposal, what made you realize that this was a more significant change than just a routine CMS update?
Absolutely. So I think the biggest thing that stood out was that it's titled a home health proposal. However, when you read into it, it covers all providers. So it is not directly limited to home health, but every single provider out there that provides Medicare care. So this is huge. This is going to be huge if this goes into effect.
Definitely. So was there one provision that stood out immediately to you?
Well, that's what, in the past, it's always been a consequence of fraud that CMS is trying to prevent. And that is not what the case is here. So this is more than just detecting fraud. So that really stood out to us.
I think you also have to look at one of the things it talked about was revocations. So currently, if something happens and you have to report it to Medicare, they will terminate that provider on the date that it's reported, or they will provide a 30-day future termination date. What this is proposing is that it's going to backdate retroactive to the date of the incident. That's going to be huge. So if something happened a year ago and you just report it, they're going to recoup all that money that was paid for that past year.
Okay, so the provider gets revoked for whatever reason, it's a retroactive consequences.
Yes, that is the proposal, absolutely.
Wow. Okay, that is
Another large thing that's going to be in this one is the managing employees. Any director on up will have to be reported to CMS. So they will have to report all their personal information that they normally have not done that in the past. So they'll have to be educated, and there will also be an amount of paperwork to do for these larger healthcare organizations that will have to report this. And then note changes to CMS when directors leave and new directors come on board. So there will be a lot.
So are they going to be treated like providers?
They will be treated more like ownership. So currently, obviously, you report your providers and they get enrolled, but you also report your owners and your C-suite people. So what this is proposing is that director level and above all be reported. So that means their date of birth, their social security number, where they were born, all of that information has to be shared.
That sounds like a huge amount of work for your provider enrollment
Of course.
team.
It is. It'll be a lot more work.
And to try and
Track
stay,
that.
yes, organized. I mean, if you are a, one small private practice, it's still a big deal because you still have to put people in that Medicare system that have never been in that system before.
And may not want to be in the Medicare system.
Correct. But if you are talking a hospital or a healthcare system, that could be hundreds of people that you have to keep track of and get all that personal information. That's a big deal.
Wow. So if you were talking to a provider CEO tomorrow, what are the 3 changes you would make sure they understood?
I definitely think the revocations that we just kind of talked about, knowing that they are going to go back, or the proposal is to go back to the date of the incident and not the date of being reported. That's huge.
I think clean data too, going over all your data, making sure everything is right, that there's no small errors that could be taken from CMS, because basically with this rule, if they find an error, they can ban you from Medicare for 10 years.
Oh,
just
wow.
any small error.
Any error. There's
Any
no
error.
tiers.
Yes.
It's just one strike, you're out.
Yep.
That's huge.
Yep.
Yes. 10 years is a long time to
It
not
is
be
a
able
very
to
long
accept
time.
Medicare.
Yeah.
Absolutely. So what changes most in the day-to-day work of provider enrollment if these changes are enacted?
I think one of the bigger issues that will happen is currently when you report to Medicare, you only do a 5-year look back. So if something happened in the past 5 years, that's what's reported. This proposal is taking that timetable off.
So anything goes.
Anything
any amount
goes.
of- Wow.
It says any look back history, a full history. So every provider is going to have to know everything that happened from the date that they were licensed and the date that they were enrolled. They will have to report everything. It's not just a 5-year limit now.
The other thing that this proposal is suggesting, if there's an oversaturated area for that particular provider type, that they have the ability to deny your application because they already have enough providers in that area. They've never done that in
They
the
have
past.
never done that before.
Wow.
So if you suddenly set up a practice and you've already, like you have a DME practice, you've got it set up and you apply and there's already too many DME providers in the area, they could say, no, we have enough. And so that would be a huge.
Yeah, that is very common with your commercial
It
payers
is.
right now. We see that a lot, what we call a closed
Closed
panel.
panel.
Everybody hates closed panels, but there's not a lot you can do because they have the right to do that. CMS is proposing to do that as well.
Right.
That's huge.
So was there anything about that that might remove people who are already providers? Are they going to, cap it and then go back and remove people?
No,
or
they
is it
won't go
just
back
going
and
forward?
remove anybody. It's just going to be
Okay.
moving forward.
Moving
So
forward.
any new providers that come in, if they feel like they have enough of that provider type or that, specialty in that area, they're going to say no.
So if you're thinking about accepting
Yeah,
Medicare,
absolutely.
get your application.
Opening a new practice,
Yeah.
That's big.
Startup, you
It
need to
is.
check that first.
Yep, it's huge.
Okay. So what assumptions do you think providers might make that could possibly get them into trouble?
One of the biggest ones will be right now, reporting is just your actual owners and your C-suite. That's going to change. So assuming that just listing the owners or listing who the C-suite people are will cover you, not anymore. Again, that's director level and above, all has to be reported.
And it sounds like they need more information now. Is that true?
Absolutely, absolutely.
Okay.
In the past too, it was the assumption, oh, if there's no fraud, we're good. And that's not the case with these. This is over and above anything, so if you're making sure that, you're doing everything above board and there's no fraud in your organization, there still could be instances where you run into problems with Medicare.
And also same with the saturation thing that we just spoke about. But also there was a comment in this proposed change about if you share office space
Yes.
with a provider that has been revoked from Medicare, they can revoke you as well.
Oh,
Just for sharing office space.
Just for sharing an
Really?
office space.
guilt by association.
Absolutely, absolutely.
Wow. Well, that brings us to the practical question. This ruling is not final and provisions may change. So what should organizations be doing today that will still be worthwhile regardless of the final ruling?
Check your data. Make sure it's accurate.
Yeah.
Make sure it's clean. Make sure there's no skeletons in the closet anywhere.
Yes.
Make sure that you are reporting what should be reported, regardless, good, bad, or ugly.
Yes.
You've got to make sure that you are reporting correct and accurate information to Medicare.
Definitely. And you can weigh in on this
You can.
until
yes.
August 31st.
Yes. So they have comments open
Okay.
for the proposal, and you can submit your comments until August 31st is the deadline.
Yes, it is.
We are going to work on submitting something
Okay.
as well, just to, this is going to be huge if it happens. So, yeah, definitely, if you have something to say, get
Now's
it
your
submitted.
chance.
Definitely say it.
Absolutely,
Speak up.
absolutely,
Speak up about it.
absolutely.
One piece of final advice, what would it be for providers and healthcare organizations?
Don't wait for this to go through.
Right.
At some capacity, these changes are going to happen.
Yeah.
It may not be the extremes that they're proposing. Let's hope not.
Some version.
But there will be some version of this because the whole point is to crack down on fraud, and we understand that. And unfortunately, there are people out there who have, just like
Right.
if somebody calls in late and they keep calling in late, everybody
get
else gets the
suspicious.
correct, and
Yeah.
everybody else kind of has to take the hit for that. So unfortunately, that's what's happening. But they have to crack down, and in some shape or form, these things will go through.
You might also consider outsourcing this to someone who deals with this on a daily basis. That way they know the ins and outs of reporting these changes on a daily basis and what should be reported and what should not be reported.
This is going to be a huge administrative burden.
Yes.
Absolutely. Well, we'll make sure that we keep following it. Thank you so
Absolutely.
much for all your
course.
advice
Thank you,
and
Clarissa.
for breaking it down with us. And again, submit your comments to Medicare, the proposed date is August 31st.
Yes.
And we will continue to follow and let you all know if any other changes are made.